call it the best day of your life, or I'm calling it a Zen moment. So you give a higher dose of IV NAD. It takes 4 to 6 hours to infuse. It basically turns on every cell that has been slowing down and shutting down at a mitochondrial level. So what it does, the NAD works in the electron transport chain to make energy in the mitochondria with our ATP, ADP, that whole. So the NAD gets into the brain as well. So it's supercharging you at a cellular level in the mitochondria. And it doesn't last forever. I mean, it metabolizes, it goes away in 24 to 48 hours. Okay. But the reason it's anti-aging is that it works in the mitochondria on DNA repair and telomere repair. So as we age, our telomeres shorten because all the enzymes that are working to keep our DNA repaired start slowing down as well. Mm-hmm. So you're jump starting everything at that cellular level and turning back on some of the repair mechanisms. Now you want to supplement that with other things that I can recommend that we know now in the anti-aging world help us on a daily basis too. But that's a huge thing to do, IV NAD. In the brain, it shifts the brain chemistry. They don't understand it yet, but they're utilizing it now in treatment for addiction and suicidal depression. Oh. So it actually snaps things on in a way that the suicidality can go away, especially if that's combined with your IV ketamine. So when they're using those two in combination, they're getting rid of suicide, depression, and addiction. The addiction, somehow that brain chemistry.
In one treatment, or is this something gives you continue forever?
Good question. Yeah. You do need some treatments. I think the protocols call for a 3 to 6 week treatment where they're doing the IV NAD initially like 4 days in a row at a high. Wow. They go up in dose. You don't get that high dose every day. They do that 4 days, then you're doing it 2 or 3 times a week for a couple weeks. Doing that in combination with the IV ketamine